40% of women have concerns about their sexual function and 12% have distressing symptoms. Is there treatment? Is there a little blue pill for women? And in my experience, what treatment option do women rave about? Today, we're going to talk about the top 10 treatments for sexual dissatisfaction, sexual pain, sexual discomfort, and how to get a better sex life. Now keep in mind, sexual dysfunction is rarely caused by one specific problem that you can just pop a pill and everything's going to get better. It's usually multifactorial. Contributing factors like body image issues, past trauma, partner relationship issues, marital discord, other medical health conditions. In fact, 65% of referrals for sex counseling result in a satisfactory improvement in sexual function. Having optimized all of these other contributing factors, there are medications, so bring on the drugs. As far as the medications, there are actually relatively few that are FDA approved for treating sexual dysfunction, and we'll note which one of those are. And there are many other medications that are very effective, but just don't happen to have gone through the FDA pathway to get approval for that specific indication. First up, we've got testosterone, or androgen, or male hormone. So this is a medication that's either given by injection, oral pill, or some type of patch that actually increases the circulating testosterone or male hormone in a woman who has sexual dysfunction. Testosterone does increase sex drive in men and in women. The androgenic or male hormone side effects in women commonly are acne, facial hair, and in high doses, which are typically not used, even deepening of the voice. But most women who are taking testosterone therapy have significant improvement in sexual arousal, sexual desire, and very tolerable side effects. Next up, estrogen therapy. So there's a very large study that looked at the effectiveness of estrogen on sexual desire, and the data just wasn't there. It didn't show an improvement. Now, that being said, a symptom of menopause is hot flashes, mood changes, night sweats, and it's hard to be in the mood with those types of symptoms. So for sure, if a woman is experiencing those symptoms and you get rid of them and you treat them with estrogen therapy, it is likely that the extent to which they affect sexual desire will be removed and the normal sexual function will be restored. And then we come to our first FDA-approved medication, which is Adi, or flibanserin, which is a serotonin agonist antagonist, and it basically modulates the neurotransmitters in your body. You can never drink alcohol when on the medicine. Also, being on birth control or taking antibiotics also affect the metabolism of the medication. And as a practical matter, virtually nobody can take this medication and get the benefit without dealing with one of the intolerable side effects. But it is FDA approved. Next up, we have two medicines that come in as treatments for anxiety and depression. Most modern antidepressants are SSRIs, or selective serotonin reuptake inhibitors. They again also modulate the levels of neurotransmitters in the body. These actually cause a decrease in sexual desire. And so coming off of one of those medications actually may restore normal sexual function. And the most recent FDA-approved medicine for sexual dysfunction is bremelanotide, or Vyleesi. Now, this was FDA approved in 2019 as a subcutaneous injection. So it's actually injected. And unfortunately, common side effects are nausea, vomiting, headache, hyperpigmentation, which in very rare cases is actually permanent. So shows a lot of promise, can be beneficial actually to prescribe a anti-nausea medicine for those patients that are on this drug. And what about good old Viagra or sildenafil? Does that work for women for sexual dysfunction? So unfortunately, it was no better than placebo in a number of different trials, with one exception for postmenopausal women with SSRI or antidepressant related sexual dysfunction. Sildenafil or Viagra actually did improve sexual function in that group of women. So what about herbal products? Maybe you just want to get something over the counter. Unfortunately, there's not a lot of data that supports any of those products, with two possible notable exceptions. One is Avlamil, which is a herbal compounded proprietary blend. It does contain some estrogenic compounds, so should not be used in women with a history of breast cancer. And then there is a feminine massage oil Zestra when applied to the genitals, which in one study did show an increase in sexual desire. So those are all the products that are available that do have some data behind usage. A couple of them, as we mentioned, are FDA approved. So in my practice, what have I seen that works the best? Most of my patients have the best results with topical testosterone or oral testosterone or a patch. They get significant improvement in sexual function. So don't forget to consult with your doctor before trying any of these therapies, and to look for any other causes of sexual dysfunction. And I wanted to hear about your results in the comments, and make sure you subscribe.